So a number of studies have shown that speech pathology students are actually very nervous and have heightened levels of anxiety about going into clinical placements and working with people, adults or children, who have swallowing disorders, which is the condition that we call dysphagia. So since 2014, we here at UQ have developed the dysphagia simulation program to add into the academic program. This allows our students in a safe learning environment to practice their clinical skills, their communication, their manual handling of patients, to practice all of that in a way that gets them better prepared for the clinic.
Working in the acute care at the hospital or working in the high dependency unit can be quite a confronting experience if you've never seen anything like that before. And the sim-based learning has really given us an opportunity to develop the knowledge, the skills, the attitudes that you need to be able to practice as a speech pathologist without putting patients at unnecessary risk. So it's been a phenomenal learning experience. So all of our simulation sessions were held in the simulation ward, where we have 10 different beds with the hospital setup. So we got the experience of seeing what a speech pathologist would look like in the real world despite actually being there. We got broken up into different groups, and we always had one that was pretending to be the patient, one that was the clinician, and often the other allied health professionals that we'd worked with.
Some of the activities that we've done in the clinic involve basically working with the experts on interviewing techniques. We've also done some therapy planning with them. They've also helped us a lot with conducting clinical swallowing exams, which has been really amazing. And we also worked on a patient with a tracheostomy, which was definitely an experience. I really enjoyed that. The clinical swallowing exam, we got to basically interview some patients, talk with them about what they're experiencing. We also got to feed them different fluids to see how they're coping. And then we got to trial some techniques that might help them swallow a bit better. So with the infants, we got to basically practice working with them and seeing how to best hold them, to position them, as well as, you know, different types of techniques that might work with the parent feeding them. The fact that we got to learn about all this theory in class, in lectures, and you don't really get to actually apply that knowledge. So being able to apply everything that we've learned with experts around us, giving us some feedback, giving us some tips that, different types of ways that might be, some things could be said better, was really helpful as a student clinician. So it's definitely been a great experience, this whole simulation.
We've been researching this program since we began it in 2014. We have found all of the students believe in the value of simulation. They have enjoyed working in simulated environments. They feel that it has increased their knowledge, their skills, their confidence, and has significantly reduced their anxiety. So it's become a very valued part of the UQ learning experience.